Hey everyone, and welcome back to the channel. Today we're diving deep into a condition that affects millions of people worldwide, but often flies under the radar: autoimmune hepatitis. So, let's get started. First things first, what exactly is autoimmune hepatitis? Simply put, it's a chronic inflammatory disease where your own immune system mistakenly attacks your healthy liver cells. Unlike viral hepatitis, autoimmune hepatitis isn't contagious. It's an autoimmune disease, meaning the body turns on itself. While the exact cause remains unknown, researchers believe it's a complex interplay of genetic predisposition and environmental triggers, certain medications or infections. AIH is considered a rare disorder, but its prevalence is likely underestimated. It affects people of all ages, genders, and ethnicities, but there's a notable trend, being 4 times more common in females than in males. While it can occur at any age, it typically affects young and middle-aged women around 50 years old. There are 2 main types: type 1, which is more common in female adults, and type 2, which is more prevalent in children, and often presents with a more severe disease course. The tricky thing about autoimmune hepatitis is that its symptoms can vary widely from person to person, and some individuals may not experience any symptoms at all, especially in the early stages. Often, the first sign might be an unexpected elevation in liver enzymes found during routine blood tests. However, when symptoms do appear, they can range from mild to severe. The most common complaints include fatigue, a persistent and overwhelming tiredness even after adequate rest, nausea and poor appetite, leading to unintentional weight loss, pain over the liver, this is typically felt in the upper right side of the abdomen, jaundice, a yellowing of the skin and the whites of the eyes, which occurs when the liver can't process bilirubin effectively. This can also be accompanied by dark urine and pale stools. Itchy skin, pruritus, often without a visible rash. This can be particularly bothersome at night. Enlarged liver, sometimes detectable during a physical exam. Spider angiomas, small spider-like blood vessels that appear on the skin. In more severe or advanced cases, especially if cirrhosis develops, symptoms can include fluid buildup in the abdomen, ascites, swelling in the legs and ankles, edema, confusion or difficulty thinking, hepatic encephalopathy, and even gastrointestinal bleeding from enlarged veins in the esophagus, esophageal varices. Diagnosing autoimmune hepatitis is a complex process that includes multiple laboratory findings, imaging, and histopathological evaluations. Here's what are the key laboratory findings that you, as a clinician, should look for. Elevated liver enzymes, specifically alanine aminotransferase and aspartate aminotransferase levels, will be significantly elevated, often more than 10 times their normal values. These enzymes are key indicators of liver inflammation and damage. Bilirubin level can be increased, as well as other cholestatic markers such as gamma-glutamyl transferase or alkaline phosphatase. Elevated immunoglobulin G levels. IgG is a type of antibody, and high levels, more than 3 times the upper limit, are a distinctive feature of autoimmune hepatitis. This elevation is an important marker for diagnosis and for monitoring treatment response. Presence of autoantibodies. These are antibodies that mistakenly attack your own tissues. Key autoantibodies found in the 2 main forms of autoimmune hepatitis include antinuclear antibody, present in type 1 autoimmune hepatitis, anti-smooth muscle antibody, also common in type 1 autoimmune hepatitis, anti-liver kidney microsomal type 1 antibody, typically found in type 2 autoimmune hepatitis. Anti-soluble liver antigen or anti-liver cytosol 1. These can also be present, and they are specific for type 2 autoimmune hepatitis. While blood tests provide strong clues, a liver biopsy is often essential to confirm the diagnosis and assess the extent of liver damage and scarring. Imaging tests like ultrasound, CT, or MRI can also show the size and shape of the liver and detect signs of cirrhosis. There are also scoring systems, like the Simplified Diagnostic Criteria of the International Autoimmune Hepatitis Group, that help clinicians establish the diagnosis based on these findings. To truly understand the impact of autoimmune hepatitis, a liver biopsy can be performed. This involves taking a small tissue sample from the liver and examining it under a microscope. In this way, we can see if there are signs of inflammation, fibrosis, or necrosis, and we can also differentiate the autoimmune hepatitis from other autoimmune pathologies like primary biliary cholangitis or primary sclerosing cholangitis. In terms of how the treatment goes, the good news is that autoimmune hepatitis is highly treatable. Early intervention can significantly improve outcomes, prevent complications like cirrhosis, and even lead to remission. The cornerstone of autoimmune hepatitis treatment involves immunosuppressive medications. These medicines work by decreasing the activity of your immune system. Corticosteroids, medications with powerful anti-inflammatory effect, like prednisolone or budesonide, are typically the first line of treatment. We usually start with a higher dose to quickly bring down inflammation and then gradually reduce it over time. Once the initial inflammation is controlled, another immunosuppressant, most commonly azathioprine, is often added. Other options include mycophenolate mofetil or tacrolimus, especially if azathioprine causes side effects or isn't effective. In some cases, especially if AIH leads to acute liver failure or if cirrhosis progresses to liver failure or liver cancer, a liver transplant can be an option. And that wraps up our overview of autoimmune hepatitis. I hope this video has shed some light on this complex condition. If you found this information helpful, please give this video a like, subscribe to the channel for more health insights, and let me know in the comments what other topics you'd like me to cover next. Thanks for watching, and we'll see you in the next one.